In this podcast episode, Dr. Ben Bikman, a prominent researcher and advocate for metabolic health, discusses the alarming connection between diet, insulin resistance, and the rising rates of Alzheimer's disease and dementia. He emphasizes the need for a paradigm shift in how we understand and approach these cognitive disorders, moving away from traditional views that focus solely on amyloid plaques and neurofibrillary tangles. For decades, Alzheimer's disease has been primarily viewed as a result of two main problems in the brain: the accumulation of amyloid beta peptides, plaques, and neurofibrillary tangles. However, these markers can only be identified post-mortem, making them unreliable for early diagnosis. Dr. Bikman points out that the drugs developed to target these issues have not shown significant efficacy in clinical settings, highlighting the urgent need to rethink our approach to Alzheimer's and dementia. Dr. Bikman introduces the concept of the metabolic theory of cognitive decline, which posits that metabolic health is a crucial factor in predicting Alzheimer's risk. Research has shown that markers of insulin sensitivity and glucose metabolism are more predictive of cognitive decline than age itself. For instance, a Finnish study found that fasting insulin levels were more statistically significant in predicting Alzheimer's risk than age. This suggests that metabolic dysfunction, particularly insulin resistance, plays a central role in the development of cognitive disorders. The hippocampus, a critical area of the brain for memory and learning, relies heavily on glucose and ketones for energy. Dr. Bikman explains that insulin resistance in the hippocampus can lead to an energy deficit, impairing cognitive function. As the body becomes insulin resistant, the hippocampus struggles to utilize glucose effectively, leading to cognitive decline. Dr. Bikman elaborates on the mechanisms of insulin resistance, explaining that it affects every cell in the body, including those in the brain. When insulin is functioning properly, it helps regulate glucose levels and promotes energy storage. However, chronic high insulin levels, often due to a diet high in refined carbohydrates and sugars, can lead to insulin resistance. This condition not only affects metabolic health, but also has profound implications for brain function. The discussion highlights the importance of understanding insulin resistance as a common thread linking various health issues, including obesity, type 2 diabetes, and cognitive decline. Dr. Bikman emphasizes that addressing insulin resistance can lead to significant improvements in overall health and cognitive function. Diet plays a pivotal role in managing insulin levels and, consequently, cognitive health. Dr. Bikman advocates for a low-carbohydrate, high-fat diet that prioritizes whole foods over processed options. He warns against the dangers of industrial seed oils, which are prevalent in many processed foods and contribute to inflammation and oxidative stress in the body. These oils, rich in omega-6 fatty acids, can exacerbate insulin resistance and promote chronic inflammation, further impairing cognitive function. In contrast, Dr. Bikman encourages the consumption of healthy fats, such as those found in avocados, olives, and animal sources. These fats do not spike insulin levels and can provide the brain with the necessary energy it needs to function optimally. He also highlights the importance of omega-3 fatty acids, which can counteract the inflammatory effects of omega-6s and support brain health. The podcast delves into the relationship between inflammation and cognitive decline. Dr. Bikman explains that chronic inflammation, often driven by poor dietary choices, can lead to neuroinflammation, which is detrimental to brain health. He emphasizes that many common health issues, including depression and anxiety, can be linked to inflammation in the brain. By addressing dietary factors that contribute to inflammation, individuals can potentially improve their cognitive function and overall mental health. For those concerned about cognitive decline or who have loved ones diagnosed with Alzheimer's or dementia, Dr. Bikman offers practical advice. He stresses the importance of early intervention and lifestyle changes. The first step is to lower insulin levels through dietary modifications, such as reducing carbohydrate intake and increasing healthy fats and proteins. This approach not only helps improve insulin sensitivity, but also promotes the production of ketones, which can serve as an alternative energy source for the brain. Dr. Bikman encourages individuals to start making these changes immediately, particularly at breakfast, which is often a time when people consume high-carbohydrate foods. By opting for a low-carb breakfast rich in healthy fats and proteins, individuals can set the tone for better metabolic health throughout the day. Despite the challenges posed by Alzheimer's and dementia, Dr. Bikman remains optimistic about the potential for dietary and lifestyle changes to make a significant impact. He believes that by focusing on metabolic health and addressing insulin resistance, individuals can take control of their cognitive health and reduce their risk of developing these debilitating conditions.